most studies, it seems to be that there's about a 5% loss in performance for trans women. In the Hilton paper, the Hilton-Lundberg paper specifically, they do an analysis of strength differences between, because we're specifically talking about testosterone now, as you just briefly mentioned, and we'll bring it back to that. Testosterone suppression as the metric by which we measure fairness or determine fairness is just wildly inaccurate and grossly unscientific, even though it was grabbed from early regulations in sport. They kind of threw the 12-month timestamp on it, and then allowed participation on those grounds. But there's just phenomenal data that was gathered in this on retained advantage. So if there's for the corresponding loss in trans women of testosterone or an appropriate loss in testosterone, its corresponding performance loss, and then the difference between that performance loss and the percentage of advantage that's retained over females is pretty astonishing. So if there was in most studies, it seems to be that there's about a 5% loss in performance for trans women, but for the majority of the time, that still means there's anywhere from a 30 to 40% retained advantage over their female counterparts.
Are you actually able to pull up Leah Thomas's time, like best time as pre-transition and then current NCAA win? Versus what her, the person who came in second was? I know that might take a second. Because that would also be kind of an interesting piece to this of
so she swam and it's still slower than like Katie Ledecky and others, but yeah, I can't see Leah's specific times. A 4:18.72 in the 500 free, compared to the 4:33. I think it was 4:33 in the championship round, which is a performance loss.
Yeah,
but it's still
which you would expect.
Yeah, yep, you would expect, and that's even what the Hilton paper points to in this analysis here is roughly a 5% loss. But even then, still enough to become a national champion. Yes. over multiple female Olympians. And so the big thing being that even muscle mass is largely resilient to a loss in testosterone.
Yeah.
And we know this from just general training.
Exactly.
But even if you pair, if you look at males to females, and let's use sprinting, so we already addressed sprinting. Males to females, there's that 10% performance gap, that was 10 to 12%, and that can, some of that is at times attributed to the difference in muscle mass between male and female, which can be up to 50%.
Right.
So even if there's a 25 to 30% decrease in muscle mass in trans women, the loss, the muscle mass loss is actually only 5%.
Yeah.
And the gap, if I can say this correctly, the performance gap then drops from 10% to only 8.5%, which if you are just on average, because we're dealing with averages, we're not comparing it shouldn't be a comparison. Now we are dealing with with one of the best in the country, but it should be about what is the average advantage over the average body of females versus the average body of males.
Well, they will maintain more muscle too, just because of like muscular hyperplasia. So I brought this up in the last episode, but someone like Ben Pollock, for example, where he was, a former pro bodybuilder, tried losing 100 pounds of muscle and literally could not lose that muscle despite his best efforts. There are certain things that are just going to be maintained, and I don't know if you have this up already, but like the IOC's requirements even for, because I think they're trying to do their best to find, what are the pieces that we can control here that will allow, this kind of trans inclusion. I don't think that there is a way to do it personally, at least not one that I've seen so far. But, the main thing that they're going for right now is like testosterone over 12 months. And if we're like even just that range, the upper end of it is like 280, I think. I've had male clients with testosterone lower than that.
Yeah, and they're still obviously benefiting tremendously from that.
Yes, because that's still, upwards of like 5 to 10 times an average female.
So the analysis in the Hilton and Lundberg paper is mostly centered around 12 months. Even if you stretch that to 36 months, that even there's a Harper paper that I'll cite as well, that concludes that even with the hormone therapy and the decrease in strength and lean body mass, the values remain significantly above cisgender women outside of even the 36-month time frame, which is like longer than anyone is bound to right now. And like we said earlier, Leah's playing within the rules. It's
all of them are. All these athletes are playing within the rules right now. It's just the rules still are coming with inherent advantages, and I think as more time goes by, we're only going to find that those advantages are more and more pronounced, not less. And I'm happy to eat my words. If this, like a year from now, it turns out I'm a complete idiot and totally wrong about that, like I'll freaking call myself out for it. But yeah.
Hey guys, if you like this clip, please share this out to someone else who needs to hear it. And if you want to hear more, there's actually a whole podcast and a whole YouTube channel. So you can go find us at Pride Fitness and Movement on Spotify, Apple, YouTube, wherever you find your podcasts. Go give us a follow, and we'll see y'all later.